Hello, everyone, and thank you so much for joining me and Judy Simpson today. My name is Jennifer Geiger. I'm a longtime volunteer with the American Music Therapy Association, and today we're going to talk about advocacy efforts with our Government Relations Director, Judy Simpson. Judy, welcome.
Thank you so much. I'm glad to be here.
So we want to start off by asking about coalitions. What coalitions does AMTA belong to, and what does that mean to be a part of a coalition? How does it help the music therapy profession?
Okay, happy to answer that question. AMTA actually belongs to several coalitions, generally based in the Washington, D.C. area, because that gives us access to all of the other professional associations that are in the area. And I'll start by listing some of the coalitions, and then I'll talk about how being a member is really beneficial for music therapy and just for the association in general. So one of the biggest coalitions we're a part of and have been for over 25 years is the Consortium for Constituents with Disabilities. And this organization has approximately 100 organizations that are members, and we paid annual dues to this organization or to this coalition. And it represents the gamut of all the providers you might find in healthcare, as well as individual disability organizations representing their populations, and then also family members and individuals themselves diagnosed with disabilities that participate and advocate on their own behalf. And so all these groups come together. And this is a great time for me to explain why a coalition works. So if you can imagine, there's actually an association of associations in Washington, D.C., because there are so many. And every issue that you can imagine probably has an association that organizes their government relations work. So when each organization wants to communicate with members of Congress or with a federal agency like the Department of Education or the Department of Health, if we were to send a letter or an email or make a phone call just representing one organization, more than likely we would not get a response back. We wouldn't necessarily get a phone call. It's like, oh yes, I want to talk to AMTA. But when you put your voices together as part of a coalition and you have 100 organizations talking to an agency and coming together with a unified message, you are more likely to move the needle. You're more likely to see progress in an issue that you care about. So for instance, in the past, when there's been reauthorization of the Older Americans Act or reauthorization of the Individuals with Disabilities Education Act, IDEA, for special education, it wouldn't be beneficial for AMTA to send a letter alone. So we work with these coalitions to send one large sign-on letter, as we call them, and then we list all the organizations that support what is in the letter. And it is amazing how much more movement and progress we can see when all of those voices come together and speak as one. Now, granted, we may not always agree, all the organizations don't necessarily have the exact same strategy or the exact same ask for that particular issue, but we work together to make the letter represent the majority of the group, and then we have the choice to sign on or not. So that's one of the best examples of why a coalition works, especially in Washington, D.C., because there's so many groups that want their voice to be heard. So with this consortium for constituents with disabilities, there are multiple task forces that are formed, because with 100 groups, just imagine all the different issues that are of importance to us. So AMTA participates in several of the task forces under this CCD alliance. And we participate in the Education Task Force, the Health Task Force. We're involved in the Veterans Task Force. We're also involved in the Autism and Developmental Disabilities Task Force. So each of those task forces hold monthly meetings, and one of the benefits of now being able to do Zoom, we don't necessarily have to all go in person. So we meet monthly with all these various organizations that participate in the task force. We discuss what's going on in Congress, what's going on in the agencies that oversee those programs. And then we decide and pick basically what's our strategy? What are our goals for this year? What do we want to accomplish? And in addition to our goals, we also have to respond to maybe issues that come up in Congress throughout the year. So maybe there's a surprise. There's a legislator who puts forward an amendment to something and we see it as a negative. So it's our opportunity then to band together and express our concern about a proposed change in federal law or federal regulations. But then it's also a time for us to give our opinions if there are opportunities for comments. Like, for instance, anytime a bill needs to be reauthorized, there's always changes in the regulations. So you have the statute that's put into law, and then the agency has to write the regulations to help administer the law. Well, there's going to be changes in those regulations as time goes by because things change within our environment. You especially saw that with COVID. And so anytime there's a change in regulations, they open up those regulations for public comment. And that's a time when we would definitely come together as a coalition and submit our comments. But then we also sometimes submit comments just on behalf of AMTA so that we can have our voice heard. The one thing that's different about public comment is that the federal agency has to respond to every comment that's submitted. So that's why it takes a while. And so even though they're going to respond to the coalition letter, as in broad terms, they will need to, like if AMTA were to submit and add something specific to music therapy, they also have to make a comment or at least include their response to that request. So that's a good example of when we would do a separate letter for AMTA in addition to the coalition. So that's just one coalition. That's a lot of activity going on with CCD. Another large group we participate in is the National Alliance of Specialized Instructional Support Personnel, or NASISP for short. And this represents all the organizations involved in special education and to some extent to general education as well. And NASISP also meets once a month and is focused primarily on communicating with the Department of Education, special education focus. There is also the Disability and Rehabilitation Research Coalition. This is a smaller group. This one also has dues. Well, most of the coalition have dues, but AMTA is a paying member. And they focus, as you can imagine, on disability research. So there's quite a bit of communication with the National Institutes of Health and making sure that people with disabilities are included in all programs and that language is inclusive in federal law and federal regulations. This group has been very active. They also meet once a month. And it's been a great opportunity for us to get a little bit more involved and to have music therapy at a smaller table that has a louder voice. So for instance, with CCD, that obviously is a great group with all those organizations, but the DRRC is usually closer to 25 to 30 groups. And because the dues are a little bit higher and a little bit more, the focus is a little bit more specialized into the research realm, we have a really strong relationship with leadership within NIH. And that helps when DERC speaks, they tend to listen and really take in what the recommendations are from this group because they represent such key players. So it's been great to be a part. That's a relatively new coalition for us, I would say probably in the last 5 to 10 years at the most. Another coalition that we're a part of is the Coalition to Preserve Rehabilitation. Now, they don't meet quite as often, at least once a quarter, but it's very similar to the Disability and Rehabilitation Research Coalition. Similar issues, similar areas, but that's a larger coalition. Once again, increasing the chance that our voice will be heard. There is also the Independence through the enhancement of Medicare and Medicaid. It's called the ITEM Coalition. We've been a part of that group for about 20 years. And that's really focused on making sure there's access to all technology or innovative practices for Medicare and Medicaid recipients. So that has been a great group as well for AMTA to be a part of. There's the Health Professions Network, which focuses more on the providers. And so this is going to be all allied health clinicians. Anybody who's not a physician or a nurse that works in healthcare typically falls under the allied health umbrella. And so this group focuses quite a bit on making sure that there are individuals learning about health careers so that there's a pipeline of students to enter different programs. It goes anywhere from small certificate programs you can get after high school to 2-year degrees, bachelor's degrees, master's, doctorate. It's the gamut of all the allied health professions. And what's been great about that group is that we've been able to actually have visits with members of Congress and with the Department of Labor to make sure that the allied health professions are represented. So some of the things we've been able to do in that group is to create a hierarchy of skills, competencies that a healthcare worker needs to have if you're going to go into allied health. And each layer gets a little bit more specific to what that profession might be. And then also just being able to have support for potential funding or loan forgiveness, or looking at programs that the US government has for students of all professions, so that they don't narrow it just to nurses and physicians, but that they can open it up to all allied health. So there's a lot of different, very specific to jobs, specific to maybe the standard occupational classification that the Department of Labor has, and making sure that those health professions, some of them are so small, like us, really do have a voice. So that's been a great group to be a part of as well. So that's kind of an overview. There's more coalitions that we participate in, but those are the main ones that we have active, regular attendance at their meetings and participate in their strategies.
Yeah, so for our listeners who are taking notes, that's 6 coalitions that you mentioned, most of which meet monthly, plus the 4 task forces that also meet monthly. Thank you, Judy, for representing us so well and for so long in these groups. I want to make one point about the Health Provider Network. Is this where we as music therapists would go to the HPN and get the identifier, the Health Professional Identifier number?
Actually, no, that's a totally separate entity. So you're thinking of the National Provider Identifier, which is something that's done through the Centers for Medicare and Medicaid Services. So the NPI is a number that every provider needs to get if they want to bill for music therapy services. It is a free program since it's run by the government, and it's actually an online link that you can go to. There's a taxonomy of all the health professions, and music therapists have their own number for taxonomy. And you would click on that, and then the system gives you a very individual number that you would then put on billing forms when you're trying to receive coverage for music therapy services. And there is a document on the AMTA website that talks about the NPI and how to apply. But if people have additional questions, they can always email me at the office. I'll give it now, but maybe we can put this with the webinar as well. Simpson@musictherapy.org if you have questions that come up from the webinar.
Thank you so much, Judy.
You're welcome.
So tell me about how AMTA advocates for other titles or licenses that impact music therapists. So for example, the LCAT in New York, how does AMTA interact with LCAT or other licenses to impact music therapists?
Okay. Well, the LCAT is actually not a music therapy license. It is a mental health license specific to New York. And in the beginning, back in the early 2000s, when a lot of activity was happening when the LCAT actually was passed, enacted into law, AMTA was very active in making sure there was exemption language in the statute so that MTBCs could still practice music therapy as long as they weren't doing psychotherapy. So we had a lot of involvement at that point, and also during the regulation writing. We were very CBMT. There were multiple, the regions, everybody participated in that process. Since that time, AMTA works with the New York State Task Force to monitor what's going on with the Mental Health Professionals Board that oversees that license, to make sure that there's never any amendments or changes or regulations that might prevent music therapists from practicing within their scope. And so we do keep track of those meetings and review the minutes and respond and provide comment and support, especially to the New York State Task Force, because they're the ones that are, boots on the ground that actually respond to those issues and a lot of times answer the questions from the local therapists. We don't actively advocate for the LCAT in the sense of what we do for music therapy licenses in the state, but we support those therapists to make sure they can still practice music therapy. And I think one of the things that's important to note about the LCAT is that although you need your MTBC to obtain the LCAT, you are not required to maintain your MTBC to keep the LCAT. And so that's one of the things that differs from our advocacy for music therapy licenses, is we keep the MTBC as the baseline. You have to have your board certification to obtain a license and to maintain a license and to renew a license. And so that's one thing that's dramatically different about different licensing systems across the country. And also the LCAT is the only state that has a license for creative arts therapists. And so it doesn't transfer to other states. So our effort is to make sure that music therapists remember that, at least for their music therapy practice, as long as they maintain the MTBC, they will be fine to cross state lines and work as a music therapist and do that scope. But since the scope of music therapy does not include psychotherapy, it's not a license that we necessarily advocate for, or we're not creating it in any other state, because we found that it hasn't maybe worked as well as what the group originally thought years ago.
Are there any other titles or licenses in other professions that would impact music therapists?
Sometimes we have to keep an eye on counseling laws, even though all the states already have counseling licensing, but sometimes their regulations might be maybe stretch their scope just a little bit, or they might say that a counselor can do music therapy, or they call it a modality instead of a profession. And so we do monitor all related professions in all the states. We monitor any statutes or regs that come up. For the most part, it hasn't been an issue. We've been able to work with those organizations at the state level to clarify the language, to make sure that music therapy is protected and is able to continue to do what is within our scope. There's a couple of other times where maybe a state might have a specific credential for, say, somebody in early intervention, or they might have a special credential that you have to apply for to work in a certain setting, and that's very state specific. So what we'll do is we'll work with individual therapists who are presented with those opportunities and educate them and give them information to share with the state so that they can apply. So it might require a different application, but we want to make sure that music therapists are included and are able to apply. So we sometimes do that type of advocacy, but that's it's almost like individual specific or very employment setting specific. It's not generally like a new state license or anything like that.
So since you mentioned the state task forces, I'd like to ask you a little bit about that.
Okay.
What are the ways that state task forces communicate and collaborate with universities or with our state and regional and national organizations?
So it really varies depending on what state it is, because not all states have state associations.
Right.
But we definitely have involvement from the regional level and from the national group, obviously. The national team includes myself and then Dina Register and Kimberly Sinamore from CBMT. We're called like the national team. And then we have our government relations committee reps from each region They're typically included on all the emails and communication from task forces. And then when we have a state association, we do our best to make sure that either a state association representative is a member of the state task force, or there's some liaison, so that there's constant communication between the task force and the state association. So it really runs the gamut. A lot of times, like, the president of the state association might also be on the task force, or the secretary, so that we have a good flow of, all the activity that's going on. We've found it really beneficial in multiple states to have that relationship, because then not only because not everybody's a member, one, of AMTA, not everybody's a member of their state association. And so we use the list of all the MTBCs from CBMT so that we reach every music therapist in a state. So the communication is to every one that we can find. And then in that way, it allows us to make sure that the state association is represented, the task force is represented, AMTA, CBMT, we're all working together. So we really do encourage that level of engagement and collaboration. But just like with everything else, there's always hiccups. Sometimes we run into some issues where maybe a state association is new, and so they don't necessarily know, what's the pattern or what's the process. And so a lot of times the national team will come in and help to facilitate, to make sure that that communication is ongoing and that everybody kind of understands their role. Because I think the state association a lot of times will focus on making sure the community knows, like, how to find a music therapist in our state, and where are the places that we're working, and can be a great conduit to the general public as well as to their state membership. But the task force is doing more of the legislative work. And so that, everybody kind of has their own role, but yet it needs to be collaborative.
Yeah, for sure. That's the way to make things work, is that collaboration.
Exactly.
Well, so how would we, music therapists or students, who would we contact if we had any needs within our state task force, or to see if we had a state task force? How would we go about figuring that out?
Okay. I think the best resource would be to go to the CBMT website, and they have a list of task force members, or at least an email, so that you could reach the task force in your state. So if you go to the advocacy tab on the CBMT website, you'll be able to find that information. And they also have information about any current bills or legislation that is still pending. Oftentimes you can find a link to what is happening at the state level in that way as well.
Great. So can you talk a little bit, Judy, about how within the states, how lobbyists are used within our advocacy efforts?
When we started this process for state recognition, everything was grassroots. Everything was, run by the music therapist. And that worked really well for a long time. But there are a few states where the population is so large, or the political system is so complicated, that we've needed to enlist the support of paid professionals at the state level. So when those situations arise, we typically ask the task forces to pull together information as to why a lobbyist is needed. And oftentimes it'll be in the states where they've had multiple years of bill introduction. Multiple committee members have given feedback. We've had hearings, we've had Hill days, and we just can't seem to get across the finish line. And so for whatever reason, and it has nothing to do with music therapy. Typically, it's not that we don't have the support. It's just because of the politics in a particular state. So what we've been able to do then is the task force presents a rationale for hiring a lobbyist. They present that information to the AMTA and the CBMT boards, and then the boards determine if they're able to financially support that effort, because lobbyists can be incredibly expensive. And it's usually not just a one-year deal. So just because you've got a lobbyist 1 year doesn't mean your bill's going to pass. So you oftentimes have to have multiple years of the same lobbyist in a particular state. So they have to look at that from not only a budget perspective, but also looking at it from how that is measured across the country. Is there a state that would really make a difference politically to get forward now, as opposed to a state that, well, maybe we could wait till next year? So it just depends on so many factors and how long the task force has been working in that particular state. That's usually how that decision is made. And maybe what the barriers have been, and if a lobbyist is what is needed to get across the finish line. So we do have lobbyists in several states coming up in 24. And then we also have a consultant lobbyist that has worked for us for over 20 years in Washington, D.C. And her name is Myrna Manlowitz. And many therapists have met her at different conferences over the years. But Myrna is particularly a special education lobbyist. And so she's our legislative consultant in all things special ed. And when you were talking about the coalitions, that's how I'm able to be at all of those things, because Myrna also attends. So Myrna, represents us in all the education things. And then we talk frequently about, well, this is AMTA's stance. Could you please represent us in that situation? Every meeting she goes to, she says she represents us. So even if it's a meeting that we are not a member of, or a coalition we're not a member of, she still says, I represent the music therapist. So that helps get our name and our presence at the table and into the conversation. So she's been our education consultant for over 20 years.
Mm-hmm. Yeah, terrific. So I'm curious if there are other associations, music or arts associations, that AMTA partners with to educate and advocate.
We have done this for years, and it has changed over time, depending on what the issues are that are affecting access to music therapy. For years, we were very much tied with Americans for the Arts, because they had their National Arts Advocacy Day. They do things a little bit differently now. So post-COVID, it's not quite the same, but we're still involved with them and monitoring what they do and adding our name to issues that apply to music therapists. We recently collaborated with the National Association for Music Educators on presenting language for a bill in Congress that would increase access to music and creative arts therapy, well, all arts really, and creative arts therapies in special education and general education. So we worked on legislative language together. That bill, we're hoping, will be introduced in 24. We work quite a bit with the art therapists on the national level. And how we do that then is working with their state chapters, because they're in a similar state recognition strategy like we are. And so in a state maybe where they have made some forward movement in state recognition, then we talk with them and we see if there's something we could do jointly. It's not that we do a creative arts license, we're doing separate licenses, but we are talking with them and trying to determine if going together and having a unified voice when we ask for a license, if that is beneficial politically, if it's something that could work at the state level. So that's a great example of collaboration there. I've had conversations over the years and actually have new connections with the National Standards Board for Therapeutic Musicians, and talking to them about how we all work within the continuum of healthcare. Where's the place for clinical music therapists as opposed to community music therapists, as opposed to music practitioners or heart therapists? And then also, where do we fit within the National Organization of Arts and Health, which is NOAA? And so those are all the non-clinical and those that other musicians in healthcare and other artists in healthcare that are working in hospitals or community settings. And where do we all fit? How do we all work together? So that's an ongoing conversation and collaboration and interaction that we try to have to make sure that information is accurate, that everybody understands where a music therapist would fit and how maybe the hierarchy of how it can work. Because I know that sometimes there are arts and health managers in facilities. And so do the music therapists answer to them, or are they, on the same level, trying to understand how we can all be in that same realm and ultimately focus on what's best for the clients. So that's another group that we, are in communication with. Those are the
Excellent.
ones that pop to my
Yeah.
head.
Yeah. It's a lot. I'm so grateful for the many ways and the many years and decades that AMTA and that music therapists have been at the table and being able to have conversations with these groups. So I'm grateful for that.
Thanks.
So I have one more question for you, and I'm sure there might be others that other things you'd also like to share. But one of the last questions I have for you is, you mentioned the role of the pandemic, and I'm curious how the COVID-19 pandemic has impacted advocacy, and if there's anything that we should be doing differently.
Well, I have to say, if there was one positive thing that came out of the pandemic, was our ability to meet virtually, because Hill days in the past were always in person.
Mhm.
You had to travel to your state capital in order to meet with your legislator,
Yep.
or you had to go to a local town hall or coffee shop when they had, a local meeting. But with the increased access to Zoom and the sense of, oh, it makes life so much easier because you don't have to travel. And you can get so much more done and create more work for yourself to have access to Zoom. It has actually increased advocacy. And, it was really something that we first were like, oh my gosh, how are we going to do ill days? How are we going to do trainings? And I'm really proud of the fact that between AMTA and CBMT working together, able to maneuver and switch to virtual trainings that we could record so people could watch them at their leisure and not at just, Tuesday night at 6:00. And we were able to move to meetings with legislators all times of the day and night, whenever the legislators were available. Music therapists who could never get the time off from work could do it over their lunch hour and meet with a legislator. And what's so important about that, it's really increased our ability to get a constituent with an actual legislator, because it's all fine and good if Dina, Kimberly, and I, or a task force chair, talk to a legislator. But if we don't live in their district, they don't care as much about what our
Right.
opinion is, so they want to talk to somebody who actually voted for them or could vote for them. And so being able to connect constituents with their legislator in real time, instead of it just being an email or a phone call, but to see them on Zoom and have those conversations, it is amazing. And we've also been able to do some committee hearings online, because not all states are requiring people to come in person for hearings. And so we've actually done committee hearings and met with other professional organizations through Zoom to talk about our concerns or any differences we might have. So I would have to say the pandemic actually improved
Wow.
the increased access to advocacy, definitely.
Yeah. So with that in mind, I'm actually curious, as someone who had to be nurtured as an advocate when it came to state recognition. What has been the response of music therapists? Are music therapists more comfortable now advocating for music therapy, or are you still finding that that there's a lot of self-consciousness about that advocating for what you love to do?
Well, I think it's definitely improved. I think people are more open to the idea. I also feel that because we've been trying to really include students as well in the process, they're not as surprised when they get finished in school that advocacy is just part of your daily life.
Yeah.
And as music therapists, I think we've always been advocates. We've always, maybe had to explain things a little bit more because people don't quite understand what it is that we do. But what I think is exciting is that even if it's folks that are brand new to the subject, they come with their passion for music therapy, and that automatically makes them a good advocate. Because really all it is talking about what we absolutely love to do, and
Yeah.
we believe in it. And so we have that passion. We already have that kind of in our system. And so what really is the only difference is changing your audience. It's no different, like when you think about it, from the very first time somebody thinks about being a music therapist, they probably had to advocate to their parents or whoever is paying the college bill or helping, I want to do this and this is why, so you had to advocate then. And then you advocate to your professors, to your clinical settings, to your internship director. And then you advocate to your employer for a job. And then you advocate to all the people that you work with in your job. And then you expand your advocacy network to people outside, to the community, to people that you meet in the grocery store, people you sit to next to on a plane. There's never a bad time to advocate. And I feel that with all the trainings that we've done and that continue to happen across the country, that just has just expanded people's comfort level with speaking up and talking about music therapy, because it's already something that's, so natural and so easy to be passionate about.
Yeah. Excellent. I'm glad that's been a culture change, really.
It really has.
Wonderful. Yeah. Well, so what are the other things you would like to share during this webinar today?
Well, there was a question that I had received about tips that I might have for fostering relationships, like communicating with different shareholders, like how do you do that and when do you do that? And it kind of flows pretty much from what the last question was.
Yes.
One of the things we started doing more at the state level is building coalitions that don't include music therapists or music therapy constituents, or consumers. And so, but organizations, like-minded organizations, so kind of taking the concept of the coalition work that we do on the national level and looking at building those coalitions at the state level. So for instance, in Illinois, and this was at the advice of the lobbyist that we had hired, really helped with the state license passage to reach out to other organizations that care about the people that we serve. So for instance, AARP, the Alzheimer's Association. We could look at the Autism Society. Most of these organizations that focus on maybe a particular diagnosis or a particular group probably have an interest in music therapy being expanded. They see the benefit. And so they might then support our licensure efforts or efforts for increased reimbursement. And so we've worked to expand our outreach and advocacy to getting those organizations to sign on in a way to our efforts at the state level. And so, for instance, when we have a licensure bill in a state, the front page of our support our bill flyer gives you the rationale, like 4 points. Why do we want this? And then the backside has the list of all these organizations that support us. Because it means a lot to a legislator that it's not just the music therapist asking for this. You want the consumers to be asking. So consumer groups are great. Parent organizations are a great way to expand that outreach. But then also, like the organizations that represent the diagnostic groups, that represent maybe leading healthcare systems within the state. And the one thing you have to think about in this is that just due to politics and some of the limitations that we have, typically state-run organizations or facilities are not able to sign on to legislative issues. So if it's a state university, more than likely they can't put their name on it, but you could have the facilities that hire music therapists, a hospital system, a nursing home chain, would be a great organization to list on your supporting coalitions. So I feel like that's a wonderful way to expand your outreach. So you, as an individual therapist, could reach out to your own organization where you work or the facilities where you contract to and ask, would you be willing to support? Would you be willing to add your name to a list of organizations that support music therapy and music therapy licensure? So those are some really easy ways because you already have those connections. And then also doing outreach to other professional organizations. For instance, music therapists do not work in a silo. So we have all these other professionals that we work with. And to have, we've reached agreements with these organizations on the national level for our language, but it's always great if we can have support from their state chapters. And so reaching out, and I would always recommend never do this alone. You have the task force to support you. So if you have connections with organizations, facilities, programs, administrators that you think would be supportive, definitely contact your state task force and let them know and work with them, because they can give you language of how to ask the question. They can give you sample templates. They can give you ideas of what to say, and can also support you then if the person says yes, then what's the next step? So the task force can help you with that process. And that I'm really talking more about when you're actually working for some legislative goal. But at the same time, it's always good to communicate to your contacts what music therapy is, what it can do for the clients, and how they can support you in your clinical work. So that was one question that I received.
Yeah.
And then the other one that maybe we've touched on a little bit, who are the other partners that music therapists should be collaborating with? So I kind of touched on that, and how to have those conversations. So I know some of the examples that someone shared with me would be like a mental health organization or policy groups in one's community. And what's interesting is that we've had some really great progress when an individual therapist who perhaps is in private practice gets involved with maybe their Better Business Bureau chapter, if they get involved with their Chamber of Commerce, if they participate in local business development, and they're not necessarily healthcare related. They have nothing to do with healthcare or special education. It's purely business. It could be a banking group, and what we have found really beneficial is not only does the music therapist benefit from the knowledge and skill set from those organizations and those coalitions, but they also sometimes have connections that can help us with any maybe access problems we're having. So maybe there's some strange rule or exception or a place where music therapy has not been able to, get access to, like a particular type of facility or organization facility, something like that. But someone in that local community is on the board of that organization, or someone knows someone who's, and so it's all about what we call grass tops. Yeah. We know grassroots, that's on the ground, boots on the ground, right? But grass tops are those folks that have influence, those folks that might have a leadership role in a particular organization. And so having music therapists kind of expand who their realm of people are, so that they don't just focus on health and education, but they think about the business world, because a lot of times those individuals are ones who can connect us with decision makers and stakeholders that maybe have access to purse strings and funding opportunities. And so once again, there's never a bad opportunity to do advocacy. Anyone you meet, any opportunity you have, you might change your presentation slightly depending on who you're talking to, but there's always great opportunities for folks to share and expand their outreach to different organizations and individuals.
Most definitely. Yeah.
So yeah.
I have one more thing I want to ask,
okay,
because I always think a little highlight reel is nice. Off the top of your head, how many state task forces do we have going on? How many states now have licensure or title protection or recognition?
Or some type of recognition? Okay, I'll give you this. All right. So this is just in 2023. So kind of give you a focus here. 3 states this year passed licensure legislation. So that was Ohio and Washington and Connecticut. 6 states were involved in the creation of regulations. So they're at that level. 14 states introduced legislation in 2023. 25 states actively participated in some level of activity. They had a Hill Day, they had a committee hearing, they met with legislators, that type of thing. 17 states have some form of state recognition, and 13 of those are licenses.
Wow.
2 are title protection, 1's a certification, and 1's a registry. And we anticipate 15 states to have legislation in 2024. There are 48 states and Puerto Rico that have been involved at some point in the last 18 years of state recognition.
Wow.
And yeah, well over 300 music therapists involved in task force activities. So it's amazing. It's so exciting to see the growth and to see the increased interest in doing this work. And also recognizing that just because a license passed doesn't mean advocacy stops. There's still advocacy to increase access to services, whether that's
Right.
through funding opportunities or whatever. But yeah, the advocacy continues, and it's such a part of who we are and what we do that I'm just excited to be a part of it and to help lead the association in that work.
And on behalf of all the music therapists and students and clients who receive music therapy services, we are so grateful. I'm so grateful for the work that you have been doing and continue to do. I think over the many years of my volunteer service, when I hear people talk about what they most appreciate about AMTA, it is the advocacy work. So I remain grateful to you, Judy. Thank you so much.
Well, thank you. I appreciate
And
it.
thank
Thanks
you
for this
so
opportunity. Yeah.
Yeah, thank you so much for doing this webinar with me today. That was great.
Well, just as I said, if people have questions, they can always email me directly or reach out to their task force through that link from CVMT.
Perfect. Thank you so much, Judy.